So again, good afternoon to everyone. We are truly blessed that this afternoon we are healthy and still together embracing learning in our own homes. So parents, if you are there, you can join our discussion. Moreover, if you can share some of your comments and you may share anything, feel free po ating pong mga parents, if you or even with your siblings who are inclined with allied health sciences, you are free po to interact with our discussion. Now, we have discussed about the adverse reactions, and we have mentioned rather that adverse reactions are untoward and unexpected effect, physiologic and biochemical effect of drugs to the person who have taken the medication or drug. However, we have discussed on the early what you call this on the early portions of adverse reactions, some of the types of adverse reactions. We have discussed about uh, the dose related reactions, because those related reactions are the ones that are related to the overdosage of medications. We have also discussed the sensitivity related reactions, which we have discussed also about the concept of hypersensitivity and allergic reactions. So when it comes to the immediate results of sensitivity related reactions or hypersensitivity reactions, we may expect two things to our client. So we may expect that our patient may possibly experience what we call anaphylaxis. So anaphylaxis is considered as a term by which, because of the stimulation or secretion of the histamine 1, it narrows the airway passages that leads the patient to difficulty of breathing. Um, if it will continue, uh, if it will continue and aggravate the situation, the total constriction of the bronchi will deprive the patient from the oxygen, and there could be retention of carbon dioxide, which may lead to the possibility of deprivation for gas exchange and may lead to anaphylactic shock. Another is the patient may develop for sensitivity-related reactions pertaining to the appearance of the rashes. It is not a macule, it is not a papule or vesicle, just like for chickenpox, but it is best described as a flat rashes that are generalized or spread throughout the extremities. So that's what we call urticaria. So these sensitivity reactions are usually treated by antihistamines, or probably prevention of exposure of the client to the cause of the hypersensitivity reaction. If we're talking about the drug, so as nurses, we must be responsible to ask medication history, and moreover on allergic reactions on certain drugs and food. So to continue, uh, the concepts, other concepts of the adverse reactions are the what we call idiosyncrasy. When we say idiosyncrasy, these are the unexpected, peculiar, if we say peculiar, unusual response of the client to a drug. Since we have talked about antihistamines or histamine 1 blockers, diphenhydramine, amine, yan, mga amine, diphenhydramine, chlorphenamine, phenylpropanolamine. So all drugs that may have amine could be classified as histamine 1 blocker or antihistamine. So usually the antihistamine may have may expect a side effect that the patient may experience the what we call slight drowsiness. But for situations that idiosyncrasy could be identified, if for example, if a diphenhydramine as an antihistamine is given to children, and supposedly the child is expected to experience slight drowsiness. So probably those children are expected to probably go to sleep or to rest. But if you have observed, the reactions of children, they become they experience hyper excitability, or they experience you have observed a hyperactivity, then this is what we call idiosyncrasy. It's beyond the supposedly side effect that the patient will experience, and opposite of it is the one that are manifested to the patients. So that is what we call idiosyncrasy. The opposite of the side effect are manifested to the specific client who have took the medication or drug. Now, let us proceed to some of the miscellaneous reactions. If we say miscellaneous reactions, these are the situations wherein we will be already alarmed. Alarmed in the sense that uh, nurses, when we expect when we administer drugs, it's within our knowledge that the two major organs that may involve or that are involved when it comes to pharmacology is the liver and the kidneys. That's why, as I even told you and mentioned even in our previous discussions, that most of the drugs are nephrotoxic and hepatotoxic. So with our succeeding discussions, we will already identify some of the common drugs, which for all of you, to identify, and we will identify as well, to for you to be guided whenever you will attend to clients who have who have administered drugs and took those drugs as being enumerated later on in our slide. Now, these are the miscellaneous reactions. If we say miscellaneous reactions, these are the reactions beyond those concepts that we have discussed about those related, sensitivity related, idiosyncrasy, toxicity. So blood dyscrasias. If we say blood dyscrasias, these are reactions that may cause a direct effect to the blood, direct effect to the drug. For example, drugs that may cause possible bleeding to the patient as a reaction, drugs that may cause inhibition of production of the red blood cells. So uh, drugs that may interact also to some of genetic disorders, which I have mentioned before, thalassemia. So those are blood dyscrasias. If we say nephrotoxicity, these are identified drugs which may have risk to affect the function of the kidney. So as what we have discussed before, to basically identify the normal functioning of the kidney, the diagnostic examination that are needed is what? If you can still remember, what is the diagnostic examination that are needed to evaluate the function of the kidney? It starts with letter C.
Creatinine po.
Very good. Thank you. So that is creatinine. So the creatinine could be our reference if ever there are some situations that the damage is brought about by the drug. So that's why it's very common, and identified monitoring for the function is specifically for the kidneys, because for those situations that may affect that may observe adverse reactions, always take into consideration if there are some symptoms or manifestations affecting the kidney. And moreover, this could be identified through urine output and appearances or non-appearances, non-appearance of the pitting edema. So we have discussed before the difference between non-pitting and pitting edema. So the edema is caused by the swelling of extremities brought about by the accumulation of fluid into the interstitial space. Now, if we say hepatic toxicity, so we are familiar with the liver that is responsible for the metabolic response of the drug, because usually in the liver we have identified yung function ng first pass effect, and with the first pass effect it secretes also some of the enzymes that are very significant to prevent toxic effect of the drugs. So we must be very careful and we must be identified. So the point on the next slide, the point that I wish to orient you on those drugs for you to be cautious, for you or for the patients to be aware also of some of the subjective data that you may use and validate it with your objective data if ever there are some of the adverse reactions that are identified brought about by drug administration. If we say carcinogenicity, di ba? If we say carcinogen, carcinogenic yan, carcinogenic. These are drugs that may probably lead to secondarily to a cancer, or there could be instances na mga anti-cancer drugs, the anti-cancer drugs may lead to a certain complications and possibly lead to a cancer. So later on I will be showing to you some of those drugs and explain why. Teratogenicity, that's teratogenicity. If it is teratogenic, the one that you may bear in mind is these are the drugs that may have direct affectations to the fetus. This may have the fetal, it may affect the fetal well-being. So that's why it's very important to know some of the contraindicated drugs that pregnant women must know because these are teratogenics. Photosensitivity. Photosensitivity, there are some drugs that once taken and exposed to the UV light from the sun, okay, from the sunlight, this may significantly also affect the effect of the drug and may cause adverse reactions. When it comes to disease-related effects, most of the disease-related effects commonly identified with drugs are mga immunocompromised situations. Just like disease-related effects are yung lupus, which is brought about by if the patient is more dependent on mga pain relievers tapos higher dose pa are taken. This may have a direct problem with the kidney, and the kidney is also connected with boosting our immune system. So another is the Steven Johnson. The Steven Johnson disease is an immunocompromised disease, which may appear uh, mga bruises in the extremities, which is evidently affecting the immune system. So these are usually brought about by the abuse of taking drugs also. So these are the two common disease related effects sa systemic lupus erythematosus or lupus. The other one is the Steven Johnson syndrome. So let us now proceed on our next slide. On our next slide, this is now the time that we will identify the the drugs and those that have identified miscellaneous reactions. Plus, just the same as just similar with what we are doing now with the vaccination rollout, that every time that you will receive vaccination, uh, the individuals are being asked on any adverse reactions within the 24 hours after taking it. So the one that monitors specifically those adverse reaction, and this will be documented as well, will still be part of the trial of the clinical trials of our vaccines, depending on the pharmaceutical companies. So the aspect of studying those adverse drug reactions are what we call pharmacovigilance. So from the term itself, vigilance. So you need to have careful studies. You need to have to monitor safety. So these are covered by the pharmacovigilance because uh, uh, in every drug that will be released out of the market, it will always identify those drugs that may specify contraindications, drugs that may not be subject for administration on certain population groups. Second is um, adverse drug reactions will be documented, so that when these drugs, even this vaccine or these vaccines that are being administered to our people now, will be also documented, and this will alarm those individuals to report to the authority or may seek immediate medical help or attention. So let us start first with the what we call blood dyscrasia. So as what I had mentioned, when we talk about blood dyscrasias, these are reactions that basically affect the blood. So it could lead to possibly affect the platelet, the drugs that may possibly affect the uh, red blood cells. So it may affect viscosity, it may affect the hemoglobin. So we must just be careful. So that's why if you will identify already those drugs that may cause high risk for adverse drug reaction of blood dyscrasia, so once we enumerate this drug, we must be careful if the client has history of blood disorders. Kasi you are putting the risk that even though the doctor prescribed it, but the nurse must be responsible of continuously assessing the client if the drug even identified with possible blood dyscrasia as adverse drug reaction may not put the patient into danger or harm. So if you will notice also in the examples that we are now projecting on the slide, is are there drugs that are numbered. Numbered meaning uh, drugs that may have multiple adverse drug reactions. Just like on the first drug, that on the blood dyscrasia, so we have carbamazepine. Carbamazepine is an anticonvulsant drug. So anticonvulsant meaning the individuals who may experience seizures, convulsions. These are the drugs commonly administered. But somehow we must think, nurses, of some risk that the client may affect the specific levels of the blood, specifically on the platelet and the red blood cells. So if you will notice, the carbamazepine also appears in the adverse drug reaction of hepatotoxicity. So meaning when time comes that you are already registered nurse, claim it, you are already registered nurses, and you are about to administer carbamazepine, there are two things that you need to monitor. You need to monitor for the status or assessed level of blood, and at the same time assess level of the liver, because this carbamazepine could be a drug that may show any adverse drug reaction affecting the blood and affecting the liver. So how the nurse will basically be assured na prior to administration of the drug, it will be safe for the client. And usually, di ba, adverse reaction comes out when the drug have been taken by the client. So tayo naman, we need to have thorough monitoring to the client, so that, kasi after the adverse drug reaction, higher level, it will proceed to toxicity level. So that's why it's very close to danger. Very close to danger. And the nurse's responsibility is have to promote safety as well as the highest priority by monitoring. So carbamazepine, we have the NSAID. So if we say NSAID, NSAID means non-steroidal anti-inflammatory drug. Okay? Non-steroidal anti-inflammatory drug. So meaning these are for pain relief, which also can be associated to steroids. But the difference is that of these are the drugs that non-steroidal. Kasi we have identified that most of the steroids, di ba? Steroids are high risk for gastric irritations. So that's why if you are an individual who are high risk for hyperacidity, you need to be careful in taking steroids. So because probably sooner or later, once it may cause the damage to the gastric mucosa, may lead to bleeding. So that's why when you are taking pain reliever at tapos you have history of gastric bleeding or peptic ulcer, so probably you may take steroids, but at the same time you may take it with H2 blocker, yung mga tidine, ranitidine, famotidine, cimetidine. But if ever the other way around to prevent the steroidal effect, you can have the non-steroidal anti-inflammatory drug. Those drugs are ibuprofen, so yung Alaxan, naproxen, yung mga we have COX-2 inhibitors. Ito yung mga drugs na non-steroidal anti-inflammatory drug na possibly may affect the blood. Moreover, for example, if you will be giving this drug tapos may genetic related disorder pala siya sa blood, so careful. So we must have extra cautious, we must be extra cautious in administering the drug. So those drugs such as coxib, ito yung mga celecoxib, telecoxib, so yung mga COX-2 inhibitors. If steroids may cause a higher chances of gastric irritations, ang NSAID din naman, opo, ay nagko-cause din ng gastric irritations because we have been oriented during the time that we discussed the route of administration that anything that we take through the stomach or ingestion may lead to CASGIP, which is the gastric irritation. So ang risk lang nito mas mababa compared to the steroids, the ibuprofen, naproxen, and COX-2 inhibitors. So these are the coxibs. So magdadinig yung mga coxibs. So next po, drug that may cause also blood dyscrasia is rifampicin. Oops, may numbered. So it's numbered. So meaning rifampicin may appear to other adverse drug reactions. And from this slide, it already showed that rifampicin is an antibiotic, anti-TB drug. This is an anti-TB or tuberculosis drug that may have chances, okay, that may have chances to experience bleeding rather, or blood disorders, and chances also to affect the liver. If you will notice, sir, it seems connected yung blood at saka yung function ng liver. The answer is yes. You must take into consideration the concepts of anatomy and physiology. Do you know that the liver is the one that synthesizes vitamin K? Vitamin K is very important for coagulation. And these are also the vitamin K are also being administered, diba, for the newborns, so that after cutting the umbilical cord, so that to prevent the bleeding, vitamin K are being administered to the newborn. However, if you will notice, since the liver has also its function of regulating the vitamin K, it has a relationship as a significant association also on the situation that it could lead to a possible bleeding if the liver will not function on the synthesis of vitamin K. Kaya that's why if you will notice, the drugs that appear in blood dyscrasia as adverse reaction may also appear in the liver. The two drugs that have been identified are carbamazepine, the anticonvulsant drug, rifampicin, the anti-TB drug. So alam nyo po class, rifampicin are usually administered on an empty stomach in the morning. This is to facilitate effective absorption. Pero again, class, withhold the drug if the patient with tuberculosis are already having manifestation or spitting already blood. That's an indication of there's pulmonary bleeding. So will you still administer rifampicin? The answer is no, because we are aware that the drug reactions of possible drug reactions of rifampicin is blood dyscrasia. So if you will still give the drug, this may aggravate the situation. So those are the mindsets that we need to consider na once you identify specific manifestations or signs that are related to the drug reactions, you have also the independent function using critical and analytical thinking to withhold the drug, because again, safety is our highest priority. So other than the blood dyscrasia, let us proceed with the number 2. Do you have any questions so far? Do you have any questions? Can I hear from the group or none so far? So it means clear po. So just unmute or raise your hand if you have questions. And I'm very much willing to answer. Even though we will cover the whole 2 hours just answering questions, I am more motivated on doing it. Let us now proceed on the number 2. Number 2 is all about nephrotoxicity. So very obviously, it's talking about toxic adverse reaction on toxicity affecting the liver, rather the kidney. So now, what are those drugs? So my purpose of why discussing first the common suffixes, because for now you are already encountering those suffixes, and these common suffixes may guide you on identifying the drugs. So just like for now, when we are discussing the adverse reactions on affecting the liver, those drugs that may identify possible adverse reaction affecting the kidney are pril. So the pril are these are the angiotensin converting enzyme inhibitor. So we have mentioned, di ba, that the angiotensin is the one that may cause the constriction of the blood vessels of the kidneys. Kasi we are aware that this is an antihypertensive drugs, and once there is increased blood pressure, the one that may regulate in assistance to rescue or to basically respond as compensatory mechanism are the kidneys. Pero with the continuous production of the adrenaline to help the heart and stabilize the blood pressure, here comes the angiotensin enzyme or angiotensin that are may cause harm, or rather may cause an effect when it comes to constriction of the blood vessels, the kidney, and kidneys is the one that will be affected, and it may cause a possibility that it may not regulate blood pressure. So liver, kidneys rather could be affected. So pril. So we have beer. So aciclovir, amlovir. So these are antiviral. Okay. So I even mentioned to all of you that we have also now an ongoing clinical trial in the if I'm not mistaken, Lung Center of the Philippines, the mononuclivir. The mononuclivir is an antiviral that are now on the clinical trial for COVID-19. Pero even though we are on the clinical trial and aware tayo that most of the antiviral drugs may affect the kidney, so we must take into consideration that the person has healthy kidney. So next po, for antibiotics, we are familiar with SIME. So yung mga SIME, XIME, cefuroxime, cefixime. So these are antibiotics class that na somehow if you will encounter it, cefixime. So nako, medyo malakas 'yan. Those are the common reactions. If you will hear those reactions, it seems this may validate na malakas siya because it may affect the kidney. If the dose are higher, expect mga kidney related complications may happen if hindi ma-treat yung certain situations. Kasi usually naman these are the drugs that are prescribed if there are problems with sepsis o yung mga tinatawag natin mga severe infections. So cefuroxime, cefixime, and I think cefuroxime is also an antibiotic that can be also be given to pregnant women. Yung safe ito to pregnant women. Pero on the other hand, kung safe nga sa pregnant women, the next thing to monitor as nurses is to ask if you have kidney problems, or at least monitor the kidney. So the next antibiotic that we may have is mycin. Yung mga gentamicin, azithromycin, erythromycin, clarithromycin. So these are drugs. These are drugs that may have adverse reactions affecting the kidneys. So if there are adverse reactions affecting the kidney, so expect natin the one that can have deviations in the function, for example, for the kidney are if there are retention of fluid, yan, pitting edema, if there are problem with urine output, yan, those are the adverse reactions na hindi expected, or these are unexpected na hindi siya side effect, but rather these are mga unusual reactions of drug. At if these unusual reactions, yan, dyan na natin makikita dun sa pril, sa beer, sa SIME, sa mycin. Plus, the knowledge also when adverse reaction appears is first, the nurse may withhold the drug because it already appeared the adverse drug reaction. The second is when you are giving this drug, your responsibility is to check the function of the kidney. Third is when you're administering the drug, you must continuously assess. Okay, continuously assess the patients when it comes to the response, such as urine output, and when it comes to the appearances and symptoms of the what we call kidney disorders. Now, let us proceed with the third, hepatotoxicity. So this affects the what we call the liver. So we have mentioned the two drugs that are common also to the blood dyscrasia. We have the carbamazepine and the rifampicin. The drug that had been added to hepatotoxicity is the statin. We have mentioned the statins in the common drug suffixes. The statins are the anti-hyperlipidemics. So we have mentioned this for cholesterol, for the lipids. So if there is an increase in cholesterol sa blood, so statins are given. And if you can still remember the discussions that we had before, that usually statins are given once a day at nighttime. And what is our reason of why it is given at the nighttime? Can you still remember that? Why it's given at the nighttime? Because of the less metabolic activity, less metabolic response at the night, so that to manage synthesis of the cholesterol. So pero when the client is subject to have the statins, I know please check also to some of your parents who are taking the mga statins. Usually yan mga atorvastatin, simvastatin, yan. These are the most common drugs. At I think these are also available for free in simvastatin, if I'm not mistaken, are free for sa mga health centers who have been identified with hypertension. Pero class, remember na if the client is having identified with disorders of liver, careful tayo sa pag-administer if it may not be contraindicated. So if you are aware of adverse reactions, you may think of the next concept, it could be contraindicated. Kasi if it is contraindicated, definitely you will not give the drug. But if it only has a possible adverse reactions, the drug can be given, but you need to monitor the adverse reactions, because once adverse reactions are given, then this could possibly withhold the drug or discontinue the drug. So any questions so far from that first three? Adverse drug reaction, blood dyscrasia, nephrotoxicity, hepatotoxicity. Students, questions?
None po.
Okay, hearing none. Thank you so much. Thank you for the response. Let us continue with the next slide. Okay, for the next slide, we are talking about carcinogenicity. So if you've heard about the term carcinogenic, the one that causes cancer, right? Pag nadinig mo smoky, rather lung cancer. So ang carcinogenic diyan yung cigarette smoke because it has nicotine. Tapos sa mga colon cancer, for example, anong carcinogenic? Ang carcinogenic are those who are eating yung mga iniihaw na food because of the direct heat coming from the charcoal, and yung napoproduce kasi doon na chemicals may attach to the food. So yan, pwedeng mag-cause ng colon cancer. Those are carcinogenics, na aware tayo. But we talk about for the drug, ang carcinogenicity appears usually on the example like oral contraceptive. Wait sir, why oral contraceptives may lead to breast cancer? So sir, do you mean all of the individuals are taking oral contraceptives are high risk for breast cancer? This is the situation. For example, if the person is not sexually active, or if the person is not sexually active, then single, then taking oral contraceptives, the point that oral contraceptives are prescribed because of some problems with hormonal issues or hormonal health problems. That's why they're given oral contraceptives. Pag if mga hormones are very active, they must be controlled with the use of oral contraceptive. Pero ang mga ang adverse reactions nito ay possibly dun sa mga single, not sexually active individuals who are given this therapy of oral contraceptive could be possibly risk of chances of having breast cancer. So yun ang dapat natin we must take into consideration as part of the education. It's not merely to have them experience fear and anxiety on it, but mainly these are based from studies na adverse reactions may lead to breast cancer. So again, to make it clarified, the oral contraceptive that we're talking about is for purposes of hormonal therapy, and usually based from studies and literatures that most common who could be high risk, or population who could be high risk of the breast cancer of those who are taking oral contraceptives are those who are single and not sexually active. Now, another drug that are carcinogenic, meaning a drug, can you imagine it, no? Drug that is used for cancer and may cause another cancer. So this is cytoxan. A chemo drug, cytoxan is a chemo drug for breast cancer. Then eventually this chemo drug cytoxan may cause also leukemia. So if we talk about leukemia from the terms of the leukocytes, white blood cell, emia is blood. Remember, class, anyone who's taking anyone who's involved actively in chemotherapy and taking chemo drugs, uh, this drug may not be selective on targeting only cancer cells. It could definitely target cancer cells, but it may also affect healthy cells. Kaya usually the cytoxan, aside from the targeting the breast cancer, it may cause also an adverse reaction affecting components of blood, specifically the white blood cell. So yun po. So next po, let us proceed to the number 5, teratogenicity. If we say teratogenicity, we have mentioned that these are the drugs that are teratogenic and may cause adverse reactions and risk for the fetus or fetal well-being or newborn. So, anticonvulsant, ayan, tatlo na yung involved sa carbamazepine. So, di ba we have mentioned carbamazepine, nag-cause na siya ng blood dyscrasia, hepatotoxic pa siya, tapos teratogenic pa siya. Kaya class, just have this try, even in search engines. If you will have a research on the carbamazepine and check for adverse reactions, pag adverse reactions, it must have extra precaution in administering it to uh, pregnant women. Tapos usually careful also for those who may have liver problems and blood disorders. So yun yung mga those are the one that keeps us oriented on safety, na everything that we administer to our patients, we must be careful and assured of their safety. That's why if I'm discussing these adverse drug reactions, you're promoting safety to your client, because for example, if the doctor prescribed carbamazepine to a pregnant mother who is experiencing seizure, so probably the doctor may prescribe not carbamazepine, but if carbamazepine is the only available drug to have the direct treatment for convulsion, what will be the nurse's responsibility? The nurse's responsibility is to check the patient's health condition prior to administration and during the administration and post administration of the drug. So again, so third na yung adverse drug reactions for carbamazepine. So PRIL. So sa PRIL, dalawa na to. So that's why I indicated to second na. So sa PRIL, ito yung mga enalapril, captopril, enalapril, captopril, those are drugs na PRIL, ACE inhibitor. So the first one that has been identified is sa kidney. So if your parents po, check nyo po parents or any immediate relatives are taking mga captopril, enalapril, anything ending in pril these are ACE inhibitors. Tapos, so check their kidney. For pregnant, medyo withhold muna ito kasi possibly may cause effect to the fetus. Antibiotic, mycin. Oh, di ba ang mycin, it has been identified in the one of the adverse drug reaction which is for the kidney. So nephrotoxic siya, at the same time teratogenic siya. So these are not the drug of choice. Kaya usually pagka nadidinig niyo yung mga drug of choice, pag may mga ganitong drug reactions at we are talking about teratogenic, mycin is not the drug of choice for infection during pregnancy because of this adverse drug reaction. Diba? So another is ACE inhibitor or pills are not drug of choice for pregnant women or pregnant patients who are hypertensive simply because it's teratogenic. So those are the knowledge that you may acquire and may boost your confidence on their safety. Next, we'll proceed with the number 6. Number 6 is all about photosensitivity. So there are drugs that could be topical, di ba? Pag topical, in-administer mo 'yan sa inyong muka, di ba? If sasabihin ng mga dermatologist, oh, you must not expose yourselves muna sa UV from sunlight because it may cause adverse reactions, which is very true. For those na natatandaan po ninyo yung mga peak pa ng mga time na may mga astringents yan. Di ba? Those could be topical topical drugs yan na once they are exposed to extreme heat of the sun, pwedeng mag-cause yan ng either photo allergy or phototoxic. So what are those drugs that may possibly lead to photosensitivity? So ibig sabihin, if those persons are taking the drugs, preventive not to expose them to sunlight. Just like an example, amine. So amine, those drugs are antihistamine or histamine 1 blocker. Yun na mentioned ko before. We have chlorpenamine, diphenhydramine, tenylpropanolamine, amine. Okay? When we talk about statins, so pangalawa na yan, so yung first one na merong adverse drug reactions na statin ay sa liver, yung statins na po na we are talking now is photosensitive din pala. So plus this will really help you. Kaya pagka if the patient is taking atorvastatin, wag ka munang masyadong upon taking the drug, wag ka muna magpaaraw, and at the same time careful also when you're taking the drug of the statins. Have you been checked that you have healthy liver? So yun. Kaya pag sinabi ng for example ng relative niyo, I had my consultation yesterday and the doctor told me that I have some problems with my liver. So yun. So may risk na siya doon when it comes to statin. Lalo na if for example, if the patient will be exposed to the UV or sun, brought about by the sun light, then chances also na photosensitivity naman yung ma-experience. So what is now the difference between the photoallergy or photoallergic to phototoxic? So if we say photoallergy, these are usually activated to sun causing skin damage. So direct skin damage, it's either it will cause sunburn, it will cause skin rashes, it will cause skin redness. Those are photoallergic. Pag phototoxic na, usually pag phototoxic na, the UV or the ultraviolet rays changes the structure of the drug affecting immune system. So ito na yung pwedeng mag-trigger sa na-mention ko sa inyo kanina na disease-related disorders na may lupus at saka may Stevens-Johnson syndrome, and they are taking the drugs. Pag na-expose sila sa araw and when they are taking these drugs, either the amine or the statins, chances hindi man mag-appear yung redness, but yung effect ng drug, chine-change niya yung structure. But it may affect the immune system. So pwedeng mag-cause ng immunocompromise. Kaya ang worst dito is obviously the phototoxic kasi immune system mo will compromise For photoallergic, it could be alarming kasi the first line of defense that will be affected is the skin. Pero pag if it is phototoxic, the immune system, which is somehow we could be unconscious that we are already affected when it comes to this photosensitivity. So far with this adverse drug reactions, do you have any questions? Students, questions when it comes to adverse drug reactions?
None po.
None. Okay, thank you so much. Feel free to open up questions po ha. Okay, next po. Now, we will now discuss alterations. If we say alterations, class, there are drugs that may not match its effect, if it is mixed with food, if it is mixed with other drug. So we will discuss those concepts. So if we say interactions, these are alterations. If we say alterations, these are deviations, these are changes that are unexpected during the time of pharmacokinetic, pharmacodynamics, and pharmacotherapeutics. Kasi for example, when you are taking the drug, tapos taking a drug, and we all know that for oral ingestion of drug, it will proceed to the stomach. Tapos uminom ka pa ng alcohol. Will it affect absorption? Yes, because that's already interactions. Another situation, when you are taking ascorbic acid, then at the same time you are taking highly concentrated fruit juices high in vitamin C, it may cause interaction to the drug. Why? Because acid to acid and mixed with hydrochloric acid. So it may have premature absorption of the drug. So those are the concepts that we're talking about. So that's why when we talk about pharmacokinetic interactions, this results from the following: changes in stomach pH. If we say changes in stomach pH, so we are familiar that the pH of the stomach is obviously acidic. So if it becomes alkalinic, it may affect the absorption. Another, there are drugs that we have been oriented that it may promote effective absorption if it is given on an empty stomach, or it must be given on full stomach. To what extent? What are those drugs that we have mentioned na must be taken on a full stomach? Steroids, di ba? Mga steroidal drugs, ano pa ba? Steroid drugs, non-steroidal anti-inflammatory drug, yung mga naproxen, ibuprofen, yan, medyo mga gastric irritants yan. So dapat it must be taken with food. On the other hand, there are some drugs that can be taken in the absence of food, such as, for example, rifampicin, the anti-tuberculosis drug, captopril, which is the ACE inhibitor. These are recommended basically to this may have an effective absorption. But again, since these drugs are still taken orally, so and generally we are aware that most of the drugs may cause gastric irritation, so careful din tayo. So next is presence of other drugs or herbs in the stomach. This is the one that I am talking about. Now, for example, if there are other drugs that you have taken at the same time, we must be aware. That's why doctors are prescribing drugs on different time, so that to prevent some drug interactions, because there are some drugs that may counteract its effect. So for example, if I will be giving two drugs, tapos it may counteract yung effect niyan, it may not be effective to the patient. So another concept of pharmacokinetic interaction is toxicity. So if we say toxicity, remember class, during the time that we discussed distribution, the protein binding factors are very important so that it could be effectively distributed to different compartments. Yung sinabi natin, intercellular, extracellular compartments, to various fluids in the body. If toxicity level comes in, it may result to drug displacement. What do you mean by drug displacement? It may not be effectively distributed. Kasi sinabi natin, di ba, it will distribute to either fatty compartment, intercellular compartment, extracellular, and others as well. So if it may affect the protein binding factors, it may affect also yung distribution. So next is, we have the term called as induction induction and inhibition. These are common terms that are very common that you will encounter when it comes to drugs. So for example, induction of anesthesia. If you say induction of anesthesia, these are drugs that may increases hepatically metabolized drugs, meaning the drug, okay, the drug will be absorbed uh, on a fast pace, induction. Tapos pag inhibition naman, these are drugs that hepatically decreases hepatically metabolized drugs. Ibig sabihin, class, obviously ang induction is the one na mabilis ang metabolism if our route is intravenous, intraosseous, pero yung mga most ang decrease ang metabolism ng drugs are taken via oral kasi it will pass through different phases pa before it will reach to the plasma. So again, the most common that we may identify here or we may know here, pag induction increases hepatically metabolic drugs, pag inhibition decreases hepatically metabolic drugs or metabolized drugs. So when it comes to drug excretion, these are situations pag if the kidney is if the kidney are affected. So class, pwedeng masabi natin that there's altered drug excretion if there are already manifestations affecting the kidney. The most of the time that I always mention to you, if there's a problem with urine output. Second is if there appearance of the what we call pitting edema and enlargement of various organs, which is retention of fluid volume. So these are the situations that may cause the possibility of affecting drug excretion. So next po, hoping you are learning po. Please call my attention if I'm doing it fast or do I need more to give example or set examples to have a simplified explanation. So please don't be hesitant. Next po, now these are the terms that you may encounter when it comes to pharmacodynamic interactions. Additive effect and synergism. Okay, class. When we talk about, I just need to go back. When we talk about additive effect, from the term itself, add. Class, remember, you may encounter drugs na ang generic niya dalawa, tatlo, 2 or more. Kaya pag most yan sa mga pain relief, sa mga antihistamines, if you can remember Neozep, just mainly Neozep. Sa Neozep meron yan phenylephrine, chlorpheniramine maleate, paracetamol. So 3 components, di ba? 3 components siya na pinagsama-sama. So pero similar actions. Ano yung may similar actions doon? Yung phenylephrine at saka yung chlorpheniramine maleate may have similar actions to prevent the histamine 1 activity. So, pero common yung common yung reactions niya. Pero pag pinagsama mo, it is still equal with the sum of separate effects. Pag sinabi natin it is still equal on the sum of separate effects, pareho din yung effect niya pero mas nagiging effective siya if it is given in 2 or more na mix na siya. Kaya even now there are some pain relievers na sinasamahan ng caffeine plus paracetamol. Yan, which is very very significant sa mga migraine attack. Yan, pwede natin masabi yan for additive effects. So tatandaan lang natin 2 or more but sum of separate. 2 or more, sum of separate effects. Pag sinabi naman nating synergism, 2 or more drugs are mixed together or produce mixed together of same effect, pero mas it will have a greater sum of its effect. So sir, what's the difference between additive and synergism? Pag additive, so and synergism, what is common? 2 or more drugs are together. 2 or more drugs are together. But the difference lang sa additive, 2 or more drugs are mixed together, equal of the same effect. Pag synergism, 2 or more drugs mixed together pero greater yung effect. If you say greater, mas it could be more effective yung management of certain conditions. So probably you may have a glimpse of a clear explanation when I set example. So this is an example. An example is we have aspirin. So aspirin, we are familiar with anticoagulant. Pero alam niyo rin po ng aspirin din ay meron niyang salicylate, and the salicylate has the analgesic property. Okay? So check the label. Check the label of aspirin, yung generic name of aspirin. And the generic name of aspirin, acetyl salicylate acid. That salicylate is the one that particular when it comes to analgesia, and analgesia controls pain. So what I'm talking about is aspirin as analgesic, acetaminophen is also analgesic. These are mixed together na nagkaroon tayo ng isang drug na Tylenol. So one drug added to another drug becomes Tylenol. So what does it mean? Analgesic gives you same equal to separate effects pero still analgesic. So additive. So more effective yung effect niya when it's mixed with the analgesic and analgesic. Unlike with the synergism, you are producing two or more drugs, but the sum itself is greater. Example, a drug that is mixed with analgesic plus alcohol. Drug that is mixed with analgesic and alcohol, mas greater yung effect. So what does it mean, sir? So pag additive effect, pinagsama yung acetaminophen na analgesic which mixed with aspirin will produce a Tylenol which is an analgesic then. Pero pag once an analgesic which is acetaminophen mixed with alcohol, greater yung effect niya. Why greater yung effect? Alam niyo po ba nang aside from yung term natin na analgesic, kinokontrol niya yung pain receptor or response. Ang alcohol po, dinidelay niya ang motor response. Ang pain response rather. Pain motor response. Kaya pag if we will have the two or more drug, the alcohol based drug and the analgesic, pag mixed together, greater sum of separate effects. Greater yung effect ng pain relief. So that is what we call additive effect and synergism. Any questions so far about additive effect and synergism? Students? Are you still with me? Students?
Yes po.
Yan.
Yes po.
Okay po. Please feel free to have questions so that I may be bothered if you may not have questions, meaning all of those topics that I'm discussing are clear po so that I may have more examples or may have a simpler explanation Okay, don't be hesitant. The next is about potentiation. So yung potentiation naman is one of two or more combined drugs exert action greater than if it were given alone. Sir, yung additive at saka synergism, what is common with each other? You will mix two or more drugs and will produce one drug to its effect. Yung sum of separate effects equal to sum of separate effects yung additive. Yung sum of effect with greater effect yung tinatawag nating synergism. Pag potentiation naman, ito naman ay yun kasi combined eh. Ito naman, these are the drugs, two or more drugs, exerts action. Bibigay mo siya ng dalawang drug na separate but it will have a greater action. Unlike for the synergism, combined yung drug produce at one drug, pero ito two drugs may be given together to have a greater effect rather than if it is given alone. So ito yung potentiation. So later we'll have an example. Pag antagonistic effect, from the third, ayan, ginamit na naman natin we have used again the antagonistic. If we say antagonistic, it's opposite, di ba? So antagonistic, controlled, inhibit, block. So two or more drugs that produce an effect less than the sum of separate effects. So ibig sabihin, two drugs contradicting with each other produce balance. So less than the sum of separate effects, it produces balance. So I'll set an example on this. An example of this are the following. Sa potentiation, A typical example, ito yung mga PAM. Di ba? We have an example of the common suffixes on PAM. Tsaka yung LAM. Yung PAM and LAM are anxiolytics. If you say lytic, disinhibit. Okay? Anxiety. So the anti-anxiety drug, which is diazepam, when mixed with alcohol, will have a greater effect. Unlike kasi dun kanina sa synergism, alcohol plus acetaminophen combined na siya. Ito, you will give an alcohol, you will give the diazepam. So it will give a greater effect na magkasabay siya rather than giving it separately or alone. So yun naman yung pinagkaiba. Yung synergism ay two or more drugs are given equal to the sum na greater siya. Ito naman greater siya rather than giving it separately or alone. So pag antagonistic effect, charcoal plus alkaloid. Plus these are usual antagonistic effect when given with poisoning, drug poisoning or food poisoning. But most mga drug poisoning to or drug toxicity. Sa mga drug toxicity, nagbibigay ng charcoal kasi ang property ng charcoal, ang charcoal po nag-absorb siya ng toxins. Sir, alkaloid is opposite with charcoal. Yung alkaloid naman, uh, pine-prevent naman niya yung harm effect ng charcoal. Kaya pag pinagsama sila, it balances yung inaabsorb yung toxic effect, binabalanse naman yung harmful effect ng charcoal. Kaya these are the what we call antagonistic effect. So these are the pharmacodynamic interactions. We have discussed about additive effects, synergism, potentiation, and antagonistic effect. Now, we will now proceed to some of the drugs that mainly and considering that those drugs that may not be mixed with each other. But for the meantime, I know that I'm too far na I'm too long na with my discussions, and I need to give you a health break. So it's almost 6:18. So probably we may have a 10 minute, okay, 10-minute break. So plus 10 minutes, so it's 6:30. So I may ask everyone to have their health break, have hydration, eat some pre-dinner to meet our physiologic needs. So we'll be back at 6:30. Yeah, 6:30. So after 10 minutes, we'll resume. Thank you so much. I'm sorry. I mute pala. Okay. So now we are talking about the topic on the drug interactions which may significantly affect nutritional status. So antacids. When we talk about antacids, these are example of drugs are magnesium hydroxide, aluminum hydroxide, maalox, simeticone, Gabascon, those these are the antacids. But once these drugs are being abused, do you know that it will cause it may cause depletion of phosphate? And phosphate is very important for the absorption of vitamin D. So for example, you have taken too much of antacids and it will deplete the phosphate. Once it will deplete the phosphate, it may not absorb vitamin D. Remember, vitamin D is very important. Aside from immune system, vitamin D is very important for the bone. So if there will be vitamin D deficiency, the abuse of antacid that led to phosphate depletion and cause vitamin D deficiency may result to what we call osteomalacia. If we say osteomalacia, uh, it will cause softening of bones due to loss of calcium. So most probably if the person may have vitamin D deficiency and experience osteomalacia, there could be a problem with the fragility of the bone which may risk the patient to fractures. So careful when it comes to taking of antacids. Take or administer it as prescribed, because too much of it may lead to phosphate depletion, may cause vitamin D deficiency, and may result to osteomalacia. So next po is we have, how about diuretics? So we have already explained this diuretics in the common drug suffixes. Those drugs ending in mide and thiazide. Di ba yung mga thiazide, chlorothiazide, hydrochlorothiazides. Pag if we have the diuretics, we have furosemide, andamide. So those are what we call diuretics. So from the term itself, diuretics, it will remove excess fluid of the body. But the point of removing the excess fluid of the body may affect one electrolyte which is very important to the body. And for the muscles as well, muscles of the heart and skeletal muscles as well. The one that could lead to a possible effect of diuretics and loss of electrolytes such as potassium is hypokalemia. Hypo, decrease, cal, potassium, imia, blood. I have mentioned about that the role of the potassium is important for the cardiac muscle and skeletal muscle because it aids in the contraction. So if it may affect the contraction of the cardiac muscle, it may not balance the systole and the diastole, the lab-dab, and possibly may lead to cardiac rhythm problems. So careful. So what could be your nurse's responsibilities when the client could be at risk of hypokalemia? You may support it with potassium-rich foods to control the problem with loss of electrolytes. So we have abuse of antacids, may deplete phosphate, it may cause vitamin D deficiency, may result to osteomalacia. And osteomalacia is softening of the bones due to loss of calcium. When we talk about excuse me, when we talk about diuretics, because of removal of excess fluid may risk loss of electrolytes, specifically potassium, and may cause hypokalemia. And this may lead to affectation of contraction of cardiac muscle and may have problems with lab-dab or cardiac rhythm. Next slide is drug effect on nutritional status, prolonged use of oral contraceptive by women. We've discussed in the adverse reactions that oral contraceptives are carcinogenic. But again for women who are not sexually active and for those single women na not sexually active and merong problem na hormonal concerns So hormonal concerns. So they are high risk nga for breast cancer. However naman, pag prolong naman ang use, ito naman yung problem. Pag prolong naman ang use ng oral contraceptive because a person who's taking oral contraceptives naman may control hormonal production So ang problem naman dito ay it may cause a problem with vitamin B9 which is folacin or folic acid and vitamin C. So it may cause this pagprolong. At ang result nito ay birth defects kasi we are aware that the folacin, vitamin B9 is the one very important for the development of nervous system. Kaya this may result to birth defects, specifically affecting the nervous system. So careful po. Next po, drug effect on nutritional status, specifically on hydralazine. When we talk about hydralazine, hydralazine is an anti-hypertensive drug. Hydralazine dilates blood vessel. So we have discussed before that there are drugs that are vasodilators, and we have also discussed the causes of constriction of blood vessels. It's either obstruction due to fatty plaques or constriction brought about by some of the substances that may lead to constriction such as nicotine, excessive alcohol in blood, that may cause irritation of endothelial lining. Now, pag ang hydralazine po can deplete the body for vitamin B6. Okay. Vitamin B6 is pyridoxine. So, if continuously taking hydralazine, it may lead to pyridoxine deficiency at result naman nito ay nerve disorder. So related pa rin sa yung folic acid and pyridoxine are related to each other. So if the person is taking anti-hypertensive drugs and a vasodilator, you must be careful because of the vitamin B6. Next is we have the food effect on drug absorption. On the food effect on drug absorption, my nephew is again in the process of tantrums. Now, when it comes to food effect on drug absorptions, use of calcium in milk and milk products can decrease the absorption. Example, when the person is taking the drugs such as tetracycline. Tetracycline is an antibiotic. Okay? An antibiotic or antimicrobial drug. So usually if these tetracyclines are given with or administered with use of mga calcium supplements or any milk products, it may decrease absorption. So much you must not administer tetracycline with milk and milk products and with the calcium itself. Next po is we have those who are fond of drinking soda pop. Ito yung mga soda pop, ito yung mga highly carbonated na drinks na mga fruit drinks, soda pop, highly concentrated, tapos mga high acid fruit and vegetable juices. Class, pag sinabi nating high acid fruit juices, obviously it may cause the premature absorption of the drug because it may have early dissolution of the drug, premature breakdown of the drug. Thus, this may decrease the absorption in the intestine. So again, basic ang question, sir, how about yung mga flavored drinks? Ang concern naman with flavored drinks, flavored ibig sabihin yung mga powdered na tinitimpla. Flavored drinks, mas mataas ang sugar over the required acid for the body. Pero usually what I'm talking about here is yung mga high acid na natural fruit and vegetable, yung extracted from the natural fruit juices na concentrated and highly acidic, specifically the soda pop. Don't ever mix it with this type of beverages, any drug. Next po, how about fatty foods? Yung glycopulbin is an antifungal drug. Antifungal drug na this drug must not be taken with fatty foods. Why? Kasi it can increase in rate of absorption. Pag nag-increase kasi yung rate of absorption, yung supposedly effect of the drug is not that expected with the desired effect. So, yung glycopulbin as antifungal must not be taken with fatty foods because it may affect the rate of absorption. Next, we have the aspirin. Ito yung minention ko sa inyo kanina na ang aspirin or ASA is acetyl salicylic acid. So meron siyang property na anticoagulant, tapos meron siyang property na for pain. Ngayon, klasa, for those na kilala ninyo nagtitake ng mga rin, aspirin, warfarin, mga anticoagulant drugs, please avoid when taking the drug foods na merong liver, foods in the liver such as decreased effect in anticoagulants by foods in the liver, foods in, I'm not referring to liver, I mean is it may decrease effect ng anticoagulants by some of the foods na ang liver yung supposedly nagpa-function, such as class green leafy vegetables. When the person is taking anticoagulants, mga rin, avoid taking green leafy vegetables because meron siyang vitamin K. So we all know that the liver is the one that synthesizes vitamin K. Tapos you will supplement pa with green leafy vegetables that is high in vitamin K. It may counteract its effect. So decreased effect of anticoagulants, don't have it with green leafy vegetables. Next, ito naman po, we have the monoamine oxidase inhibitors. Ang monoamine oxidase inhibitors such as imipramine, as an example, imipramine, these are drugs by which it must not be mixed with, or it must not be taken with aged cheese, chicken liver, chocolate because of the tyramine. The tyramine is the one that will decrease metabolism of this drug. So better, this is somehow you can now relate yung essence ng knowing nutrition and drug effect. So this is the best time for you to acknowledge, or to rather to appreciate. After my nephew, the dogs. For a while. So thank you for understanding those interruptions. Okay, now let us continue. When it comes to the, as what I have mentioned, the monoamine oxidase inhibitors, so this must not be mixed with aged cheese, chicken livers, because of the content of tyramine, because the tyramine is the one that will decrease the metabolism of the drug. So to continue, I know you're familiar with this licorice or licorice flavored candy. If you may encounter this in mga candy stores. Class, Do you know that licorice and licorice flavored candy can counteract the effect of antihypertensive drugs, and moreover may lead to the possible toxicity of the drug. So mga parents po, if you are taking licorice candies tapos you may check that in the content, or you may have it search po that the licorice flavored candy po must not be taken with the antihypertensive drugs. It counteracts its effect. Second, you have the chance of toxicity of the drug. So be careful po. So now, we will now continue on the phases of clinical trials, which is somehow related to the the topic. This is related to the topic pertaining to the asynchronous sessions that you may have. There are the phases of clinical trials. These are preclinical trials, phase 1 studies, phase 2 studies, phase 3 studies, and phase 4 studies. Question, sir, where are we now on the vaccination? We are on the phase 3 studies. So we are not reaching phase 4 studies. Once the drug or the vaccine reach the and pass the phase 4 studies, then this could be commercially available, meaning it could be sell in the market. But as long as the trial is not yet done and not reaching the phase 4 studies, these drugs or these vaccines must be given for free. So what are what we call Food and Drug Administration of the Philippines? The Food and Drug Administration of the Philippines is the one responsible for the regulation and enforcement of drug evaluation and distribution policies. That's why here in the Philippines, our vaccines are given EUA, the Emergency Utilization Authority, for the vaccines to be given and administered to the Filipinos, because the FDA is the one who have their mechanisms and pool of experts to identify if the vaccines can be administered safely to our countrymen. Now, let us now proceed with preclinical trials. If we say preclinical trials, it will not yet involve humans. Usually for clinical 1, 2, 3, and 4, humans are involved. But for preclinical trials, we are using guinea pigs, laboratory animals, and not humans. So, plus, there are two main purposes. We have the presumption that the effect ng any drug that are being trial, that are processing with trial to laboratory animals may have the same probability or effect to humans. And usually these are also being observed to laboratory animals when it comes to any adverse effect. So that's why usually rats po ang ginagamit for this purpose of having the preclinical trials. Now, when we talk about preclinical trials, usually some of the preclinical trials are discarded, meaning it may not push through to clinical trial 1 because of some reasons. The two reasons is that of for example, if the drug that are being tested is to lower down blood sugar. So since this is experimental, they will identify the blood sugar of the laboratory animals, and they will have the baseline blood sugar level. So if the intention of the drug is there must be a significant effect on the level of the blood sugar, then eventually this may cause the possibility na if there is no significant result on decreasing the blood sugar, then it will discard the trial. Second is, for example, the drug being administered as a trial to the rats are too toxic, meaning possibly it leads to death, or possibly it's shown an adverse reaction, it may not proceed to clinical trial 1. It will be discarded. While if we talk about phase 1 studies, phase 1 studies are already through the use of health human volunteers. Meaning, unlike for the vaccines, right? Vaccine mass yan eh. Population groups. But when it comes to phase 1 studies, they will ask for health human volunteers. Health human volunteers, ibig sabihin most na healthy human, most of the selected individuals are healthy human volunteers. Unlike for phase 2 studies, sa phase 2 studies, they will already select those individuals with the identified diagnosis. But for the phase 1 studies, these are a pilot study which may select small number of individuals, of healthy human individuals. But when is the time? When is the time that phase 1 study will be dropped? Okay, and this may not proceed to the clinical phase trial 2. So if they lack therapeutic effect, meaning if the objective of the drug is to lower blood sugar but no significant effect when it comes to lowering down of the blood sugar. Second is if there are unacceptable drug adverse effects that could be causing harm possibly to humans, or merong recorded na adverse reactions that causes harm to humans. Next, we have the highly teratogenic. If we say highly teratogenic, these are the drugs highly teratogenic. These are the drugs which possibly, based from review on the phase 1 studies, may affect fetal well-being. And for phase 1 studies that it may consider the dropping of the phase 1 studies if it is too toxic. So we have 4 reasons if we will not continue phase 1 studies. Our population is small group, healthy individuals, and there are 4. Less therapeutic effect, tapos unacceptable adverse reactions, highly teratogenic, ibig sabihin this may affect the fetal well-being, and 4th, if it is too toxic. So if these findings are, or reasons of findings are being recorded, it may not proceed to clinical trial 2. So it means pala sir na yung vaccines nakapass sila sa criteria na 4 na ito, na less toxic, not highly affecting, not teratogenic, it has therapeutic effect. So ibig sabihin with these 4 criteria, the vaccine have passed. So now when is the time to consider the phase 2 studies? For phase 2 studies naman, this is the time that it will involve the physicians that will use actual patients. So sa actual patients na to, identified na po yung specific population groups na target. Example, if we are talking about the purpose is to lower blood sugar, so very obviously, those individuals who have been identified with the concern with the blood sugar are those who may have diabetes. So they may have informed consent as to the principle of autonomy, but when is the time that phase 2 studies will be removed? So again, it will not proceed to clinical phase 3 if, again, same with clinical 1, it reached phase 2 pero less effective. So it tried already to diabetic client, but for example sa phase 1, it has the good effect for healthy individuals. But for those who may have diabetes na, for phase 2, less effective, so remove yung phase 2 studies. Too toxic if it causes adverse reactions as well. Tapos usually phase 2 studies may mga unacceptable adverse effects na instead of lowering the blood sugar, this may affect significantly yung supposedly to support to lower down the blood sugar. Next is we have the low benefit to risk ratio. So ibig sabihin low benefit to risk ratio, class dapat high benefit dapat ang expected natin eh. High benefit. It may benefit our target individuals of the drug that are being on the process of trial. Pero kung low benefit tapos yung risk pa, yung risk of developing or not managing the condition of the patient with this drug, so it will remove. Tapos no more effective than other drugs already in the market. Example, If there are drugs that are already in the market of the objective na the same drug are intended to lower down blood sugar, this could be a criteria to remove the phase 2 studies. Unless one drug will use one drug as experimental and the drug that are being proposed as being tested of which of the two is effective. Pero pag if one drug is only a process on the phase 2 studies, tapos no more effective data, no more effective results are being identified, it may not be pursued. So dito sa phase 2 studies, it may not pursue. Pero if in the phase 2 studies, it passed through the phase 2 studies, ayan na. Pasok na tayo ngayon sa phase 3 studies. Kaya if you will notice sa phase 3 studies sa mga vaccines, may mga brand na sila. Pag nag-pass na ng phase 3 studies or pass na ng phase 2 studies papunta ng phase 3, these are the ones na identified na yung brand name, generic name, and so on and so forth. So use of proposed drug in a wide scale. So kanina, if you will identify preclinical, laboratory animals, clinical phase 1, healthy individuals, tapos phase 2, identified groups or patients with disorders already. This is supported by the physicians. Pag dito sa phase 3, wide scale. Just like with the vaccines now, it's wide scale. It's nationwide. It's being administered to localities and regions. So this is the point that drug that finished phase 3 are evaluated by FDA. So ito yung mga nag-phase 3 trial sa ibang country. And if they pass the phase 3 trial in other countries, these are the documents that they are submitting to the FDA so that to facilitate the trial naman here in the Philippines. So that's why it was already identified yung brand name or yung trade name. Yung brand name or trade name, the pharmaceutical company is the one that is giving the name of the drug. So actually ang Sinovac is a pharmaceutical company and the Covax is the one that is considered as a vaccine. It so happen lang that we are more familiarized with the Sinovac as a pharmaceutical company. So yung brand name is the one that are being given by the pharmaceutical company. The generic name is the original designation of the classification of the drug. Okay, classification of the drug, yung mga generic, yung mga the one that we are using for common drug suffixes. These are on the phase 3. The chemical name naman, the difference with the chemical name, these are the ones na anti-hyperlipidemics, anti-hypertensives. Yun naman yung that's the one being covered by the chemical name. And if we will try to summarize when it comes to the phase 4, sa phase 4 it passed through the preclinical, phase 1, phase 2, and phase 3. In the preclinical, initial trial with laboratory animals. For phase 1, our population are healthy individuals. Ang target natin is safety. Okay? Sa phase 2, participants with identified disorders, there are two aspects that are being tested. Remember this, there are two aspects that are being tested pag phase 2. Yung efficacy niya tsaka yung side effect. Okay. Now, pagdating sa efficacy, di ba we have discussed this and defined this that this considers the maximal effectiveness of the drug, or should we say the vaccine. Pag phase 3, testing of the drug or vaccine to participants na tatlo na. Okay, 3 na yung 3 na yung mini-measure. Efficacy, effectiveness, safety. Yung effectiveness kasi is basically targeting yung results na mas less ang adverse reaction. Yung efficacy is based from its effectiveness from the clinical trial from other countries. So in this situation, yung effectiveness ay mini-measure na on an actual wide-scale administration of the vaccine. So again, phase 1 safety, phase 2 efficacy and side effect. For phase 3, efficacy, effectiveness, and safety. Ang phase 4 naman, ito yung post-marketing surveillance. What do you mean by that? Alam niyo po ba na since we have I know each one of you have already received the vaccines. of different brands, of different brands. What will be now the responsibility of the pharmaceutical companies? They will still continue the study for the next 1 to 2 years pa. For the next 1 to 2 years, they will consider the phase 4 because they will identify the specific population group. Kaya that's why if you remember, it took 2 years. Yan It took 2 years to consider 12 to 17 years old na bibigyan ng vaccine this time, because it is just recently released yung phase 3 trial sa 12 to 17 years old from other countries. So since FDA have given the authority na and to administer the 12 to 17, ibig sabihin the pool of expert identified its safety based from the clinical trials from other countries as results of findings. So ibibigay na yan. Pero try to imagine, yung 12 to 17 years old pa lang ngayon po are those who may have comorbidities pa. Hindi pa yung well na children, yung with comorbidities pa. Kaya that's why, bakit kaya more on comorbidities yung kinonsider pa? It's because they are studying na if it is given to 12 to 17 years old na comorbidities, ayan, itetest yung tinatawag nating efficacy, effectiveness, and basically safety. At class, remember, we have already mentioned about the booster. So now, ang booster, ina-identify ulit yung priority are A1, those are the frontliners and the aging population, kasi sila yung first group who have benefited from the vaccination rollout. So sila na yung bibigyan ngayon ng booster dose kasi they have been evaluated for months as recipients of vaccine. Now another test for the phase 4 is yung booster dose. So it will really take yung phase 4 na ito a long process again before, but once it will be given to the study, complete na yung study. Alam na natin what are the population groups that are contraindicated itong vaccines, adverse reactions, complete findings. So ibig sabihin, the whole drug literature is complete, whatever questions you will ask about the vaccine. So this is the preclinical one, a clinical phase, phase 1, phase 2, phase 3, and phase 4. So I think that is the coverage of our topics for discussion for today, which is already part of the midterm period. And next meeting on Monday, we will now start discussions on the topic pertaining to drugs in pregnancy and lactation.